Yeah, I'm Chandelle, Randall, community maker for Penwith and specifically focusing on West Penwith.
And I'm Manda, Brookman, and I'm the community maker in East Penwith, both of us working with Volunteer Cornwall.
Okay, so what's a community maker then? What sort of things do you do?
I describe my role as finding the live wires in the statutory health and care sectors and joining them up to the live wires in the voluntary and community third sector, which includes individual volunteers and large and small organisations, and seeing how we can collaborate.
So I describe it as linking the health and care sector into the third sector, the voluntary and community organisations out there on the ground, providing a whole wealth of different services and activities for people. So linking people back into those provisions to tap into the social isolation and loneliness and myriad of other health issues that the community can help support.
Okay, so you're both based in Penwith, so what things specifically are you getting involved with in this community?
I think the interesting thing about being a community maker is we've got the same job title because there's a number of us across the county and there are more coming on stream, but we all end up doing quite different, diverse, interesting things. So, for example, some of the things I'm involved in at the moment would be the stuff that some of the other active community makers are doing, such as social prescription and active signposting, where we enable reception staff from within surgeries to have a better idea about what's available in their community so they can give exactly what might be required by somebody coming into the surgery that might not be a GP. And we're all doing work on that, but also specifically, for example, I'm working with one of the surgeries to help them develop very specific activities around the surgery, including a Nordic walking programme, including input from local volunteers that can talk about diabetes in the waiting room, to helping build a sensory garden on the land that the surgery owns, so that volunteers from the local community and the surgery can get involved in making and then using that garden, pulling together issues around health and food and activity and community and connection all in one.
How do I follow that? I mean, we're working. I've just moved into the area from covering North Carrier, but we're working with the PPGs as well, the patient participation groups, because obviously they're really key groups. They're the eyes and ears of the community within the surgeries, so they can help us to tap into all those amazing community resources. One of the other projects I'm involved in at the moment is the Jubilee Pool project. So that's a really brand new project, but looking at how there's going to. I don't know how much I really want to say of this live because some of it's confidential, but yeah, we're looking at what the community can tap in as part of a free provision that they're going to be providing. So working with and within project groups to ensure that the community voluntary voice is there as well.
It's really exciting. There's obviously like a lot that's going on down in Penwith. So what sort of things are you hearing today that you perhaps hadn't expected to hear?
I'm not sure there's so much that I wasn't expecting to hear. What I do can, because a lot of the issues come up again and again and again, a lot of it is around permission to change, the ability to maybe bend or change rules that aren't working, the ability to expressly say we need to connect more and move more information around. I think what happens is you come away with different ways of doing that each time. So the issues are the same for me that I come across, but how we then implement solutions on the ground. A lot of this is around the notion of ABCD, which is asset-based community development. So rather than doing to a group of people or a community, it's figuring out what there is and then how we work with those communities to enable them to figure out how they connect or themselves create what's been referred to as sustainable, compassionate communities, which is a very sort of holistic sense.
So if we've been talking about some of this stuff then for a long time, what do you think is sort of inhibiting us then from actually just going ahead and actually now doing it?
Habit.
Yeah, culture.
Yeah.
And how can we there's an amazing readiness out there. I mean, in that room, there's people from all different parts of the NHS and from the third sector, and a real willingness from everybody to get involved and connect and do things differently. I think sometimes in our organisations, we're kind of bound by specific targets and specific work streams that we have to tick certain boxes, which can sometimes inhibit our ability to work more creatively and more broadly and more collectively and collaboratively. But in that room, there's a fantastic willingness to let's connect and let's do things differently.
Yeah, I think it's definitely about sort of a shape that we do have lots of we love hierarchy, and that stops people being able to give themselves permission to think creatively or disruptively as a positive deviant, doing things differently because it's the right thing to do. It's very difficult when you've got a system like that. I think what we're trying to do is build outwards and build horizontal movements for change, that people know that they can transgress what were previously seen as boundaries, and actually do things differently by connecting to the people. So there were some fantastic conversations in there with somebody who works with the police force, dealing with lots of the same issues, institutionally and in terms of their work on the ground with communities, that the health sector might be working with. So it's how do we say, oh, that's interesting, how can we find a way of talking to each other so that we can all learn and all contribute to this notion of a more sustainable and resilient and connected community. We talked about Canaries in the mine. How do we find ways of ensuring that the community understands itself and can take responsibility for itself, whether to do with whether that's well-being or places that we live in or health, and figure out when something might be going awry, so we can get in early as a community and figure out collectively what those solutions might be, rather than operate in a very individual way and then expect a service to fix it further down the line.
With regards to Canaries, we're thinking about the people already out there in the community that aren't in the spaces that we normally think about in terms of health and well-being, but are people, say, out there in the grocers or in the pub or all these community spaces that are key connections for people within that community, so they will notice the vulnerable and maybe the isolated people within their community using their services and be the first people flagging up, oh, there's been a real deterioration in that person, but may not know, well, where do I turn? Who could I, instead of holding this information, who could I hand this information over to, or how could I help with this scenario other than seeing this gradual decline in this person? So they're at Canary, they're noticing the first problems before any other organisation or statutory organisation may be noticing it.
Yeah, and one of our fab colleagues in the health sector noticed that this is already happening in Scilly, where in actual fact if things get very, very difficult and the weather comes in, people go to the pub and head to the pub because that's where everybody else is. So that means that that's immediately a place where people are gathering, and as Chandelle says, if there are places where people can connect, then you can ask somebody if they're okay, if they're looking a bit under the weather or they haven't been coming in as regularly. And the difficulty that we face is that the way that the planning system works is that those community spaces aren't necessarily the priority, and we tend to be designing them out rather than designing them in. And if we haven't got those places where people can connect, which is the connect bit of what you were talking about, then it's very difficult to notice anybody in your community. It's very difficult to get in at the beginning before something starts going awry, because stuff goes awry in all of our lives all the time, and usually it resolves itself, but sometimes it can take a bit of a steep decline. So it's understanding how that happens, and that we have a responsibility and an ability to engage and connect and just reach out to somebody if we think that might be of benefit.
And linking to your third, so the community. So within that context, we're all community making. We're not looking to a specific organisation, we're not looking to the NHS to solve everything for us. We've all got an individual responsibility, but there's responsibilities within communities and reliance within communities that we can tap into.
Yes, and that comes back to the notion of confidence, that if people don't feel they've got the right, because that's not what we do, we've forgotten, we've lost that habit, or they don't know where to go, as Chandelle says, then that sort of makes it a bit tricky to sort of intervene or take action. Intervene might just be asking somebody if they're okay. And then knowing what else there might be available, so that if you're talking to somebody and it turns out they're okay, they're just a bit lonely, that you then have the confidence to go and say, actually, there's something over here, and I think that if we connect this person with that group, or ask that group to sort of check in that person with their permission, then you have a sense of that community taking responsibility for itself and being confident in its ability to take care of itself. That's not to say that those statutory services aren't required, they really are. What we're talking about is making sure that the people who use them, or the people who are poorly and require that sort of level of specialist service, that we as a community aren't reneging in our responsibility and ability to deal with what might be something more to do with social isolation or loneliness or having a bit of a low period, sharing the load across all the sectors.
So no pressure then. So how are you going to use what you've heard today to sort of shake things up, start a revolution so that in a year, 18 months time, we're not still here mulling over the same issues and asking the same questions?
Oh, it's definitely happening already. If you look at the sort of activity that's happening across the West, across Cornwall generally actually, but specifically across the West, there are all sorts of new activities, innovations, enterprises, different ways of breaking the mould, doing things differently. Whether it's to do with individual surgeries, individual third sector organisations, a culture between the third sector and the statutory sector, fantastic people in both really determined to make a difference.
And meetings like this, pulling people together to have those conversations and to talk about these different ways of working and to talk about what we want to do differently. I mean, today we were only talking about something we badged as treasure hunts, where we were looking at taking a few different people around to see some of the on-the-ground stuff that is happening out there in Penzance that people aren't aware of, and it's an amazing resource for people to tap into.
But if they're sort of working in the statutory sector, up to here, busy, they don't have time to understand that. And our role as committee makers is to make the connections between those staff and the extraordinary array of third sector organisational and individual support that's on the ground. It's just a matter of joining the dots.
If you had one thing that you could, or one message, sorry, that you could sort of give to policymakers, decision makers across the NHS and Cornwall Council, what would it be?
For me, it's be positively deviant, be creatively disruptive. There's lots of changes and instabilities that we're dealing with at the moment, socially, economically, environmentally. Climate change is a really big threat multiplier. Unless we deal with the way in which we presume things work and are willing to maybe bend and break the rules and think creatively, then I think we're going to struggle.
I couldn't disagree with any of that, and I'd say continue to work collaboratively, bring more partners around the table, because different organisations have so much to offer and also have their networks. And if we are going to then look to tackle some of the huge issues coming down the line, such as climate change, then we've got these structures in place to start thinking.